I'm going to highlight the clinical support materials put together for the Shared Care Polypharmacy initiative in residential care. In this first slide, we look at the opportunities for doing medication reviews in a facility. There are standard times, such as the twice-a-year medication reviews done through pharmacy, where a pharmacist and a nurse will do the reviews, and perhaps a medical advisor. In addition, there are opportunities when someone's admitted, and over and above that, there are opportunities when someone's having a period of decline, such as a fall. And we have been discussing this with people in the prototypes, and they think that this is going to be a valuable approach for them to know where to focus their efforts. Now, we found in our discussions with the people involved in the various areas that there are a number of considerations. Certainly knowing what the evidence is important. But also knowing that there isn't direct evidence for most things in frail elderly, we have to look at an interpretation of evidence. In addition, when you change medications, you're going to want to do a monitoring and review, and that takes time. And there's concerns about that. But balanced off for that is the time to actually do medication administration. So if you're reducing medications, then you're saving time on that side. In addition, another concern is about the promotion of non-pharmacologic approaches for managing situations such as behavior change in the residents. That takes time and a certain skill. But that's balanced off by the adverse events that are caused by medications, which takes time as well. So that's important to remember. Very important is the consideration of relating to the resident and family to be involved in decision making. And we'll be looking at that as well. Now you'll see before you a diagram, which is a drug algorithm generated from a research study, because we wanted to look and see whether there was evidence and approach that we could use as far as doing medication reviews. This has been retailored a little bit to match the clinical process that I felt that we would use as physicians. You'll see that there's general considerations, which is looking at the general evidence in the population, then in seniors and frail elderly, but also looking at adverse event profiles. And then looking at the risk-benefit ratio in relation to that to help with your decision making. Then you take that information and look at the individual resident that's under review and see what the indication for medication is, what adverse event profile they might be having, and then you can make a better decision about medications for that particular individual. Now, we've put together a number of different clinical materials to support decision making. A very important part of that is the drug advisory sheets. And the drug advisory sheets are in a number of different drug categories that we felt were important to specifically target. And they take an approach that follows the algorithm, looking at the evidence, the adverse event profile, and risk-benefit to provide support for decision making. In addition, there are condition advisory sheets, which more generally look at certain conditions pertaining to seniors, in addition to for residents in residential care, but general seniors as well, which were felt to be important to address. You'll see in these next two slides that the highlights of recommendations that are in the drug advisory sheets. I'm not going to go over all of them, but you'll see that it's not always about discontinuing medications. In many situations, you're trying to reduce the potential for adverse drug events, so you may do drug dosage reductions, such as for antihypertensives. In addition, some medications aggregate together, such as medications for osteoporosis, and so recommendations are done in relation to that as well. In the final sheet, there's an aggregation of medications used for psychiatric conditions, where really it's a balance of using non-pharmacologic approaches with the appropriate use of medications in residential care. And so we have advice as to that. So thank you very much.